Today's video is about a very common condition that can occur in both males and females, but more common with women. It is about hemorrhoids. You may be watching us today to understand what hemorrhoids are and available treatments. So let's start from the very beginning. Hello everyone, I am Ume, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. So what are hemorrhoids? Hemorrhoids or piles are swollen veins in the lower section of the rectum and anus, often as a result of increased pressure due to excessive straining during bowel movements, sitting too long on the toilet, chronic diarrhea, and constipation, and sometimes due to pregnancy. Hemorrhoids are one of the most common causes of rectal bleeding. Now there are 4 stages of severity, and if caught early, they can be cured often with change of diet and behavior. Eating proper foods and reducing the time needed in the toilet can have positive effects. Now, if caught when severe, typically stages 3 and 4, surgery to remove the protrusions can cure the condition. Our role today is to answer most of your questions regarding hemorrhoids. Today we have Dr. An, who is a leading doctor at Hanyang University Hospital in Seoul. He's going to discuss with us about hemorrhoids from an experienced medical point of view. So what exactly is hemorrhoids?
Hemorrhoids is the presence of protrusions of swollen veins outside of the anus. The chances increase with age and gender being female.
Any symptoms that we should watch out?
Most common symptoms of hemorrhoid is rectal bleeding during bowel movements. Another is a protrusion of tissue outside the rectum. At times, the protrusion goes back in, and at times they stay outside, which can often be put back inside by finger push. Other than those, we can say pain is a symptom.
So it's really important to have examinations, right?
When you have these types of symptoms and visit a hospital, a visual exam and a checkup of the rectum with a finger is vital, as well as endoscopy.
So in the case that it's confirmed it's hemorrhoids, what kind of treatment are there?
We can divide the treatments into surgical and non-surgical. And depending on the severity, we can decide whether to take the surgical route or non-surgical route for treatment. There are 4 stages of hemorrhoids, from 1st to 4th. In the first stage, there is no protrusion, but there is bleeding. Also, you can feel a lump if a finger is inserted. In the second stage, there is protrusion, but it tends to go back inside on its own in due time. In the third stage, the protrusion tends to not go back inside on its own. The protrusion does not return inside. So, in general, we recommend surgery for stages 3 and 4, where a finger assistance is needed to place back the protrusion. But even in second stage, we sometimes recommend surgery if the patient tends to lose lots of blood, leading to anemia.
I didn't know there are so many levels. So in the case of 3단계 이상 for surgery, is there any diet that you should follow after the surgery?
Hemorrhoids tend to worsen if there is constipation or frequent bowel movements during diarrhea. It is best to avoid foods that promote constipation or diarrhea. If one has constipation, the patient should eat foods or intake medicine that soften stool. Or if one has diarrhea, medicine should be taken to reduce it in order to make the stool more solid. Also, alcohol and tobacco, especially alcohol, should be avoided.
So, last question, what should we do to prevent to have hemorrhoids from the beginning?
Avoid spending long time sitting on the toilet. And since constipation and diarrhea worsens hemorrhoids, it is best to avoid such circumstances. Also, when too much alcohol is consumed, the hemorrhoids worsen due to dilation of veins. Those who consume lots of alcohol tend to have a very dire time. So it is best to avoid drinking. Also, it is best to avoid stressful situations. And for pregnant women, special care is needed as they tend to be prone to hemorrhoids, as those who have hemorrhoids tend to worsen, and those who never had hemorrhoids are increased risk during pregnancy.
According to Dr. Ann's interview, hemorrhoids tend to occur in people as they age, and more particularly in women. The most common symptom is bleeding during bowel movements. Also, there could be something protruding outside. Sometimes they can disappear on their own, and in some cases they can place back the protruding tissue back into the rectum by using one's fingers. These could be accompanied by pain. These are the most common symptoms of hemorrhoids. Now, to ascertain the presence of hemorrhoids, a doctor would do a visual checkup of the rectal area, as well as using an endoscope to examine further. Once hemorrhoids presence is conclusive, there are surgical and neurosurgical methods to cure the condition. Whether a surgical cure is deployed depends largely on the severity and stage of the condition, which can be divided into 4 distinct phases. Stage 1 is when there is the rectal blood and hemorrhoids can be felt with fingers exam inside the rectum. Stage 2 is when there is outside protrusion but tends to return into the rectal area on its own. Now, the third stage is when there is protrusion outside that does not go back inside unless pushed by fingers. The fourth and last stage is when the protrusion does not get back inside, even when pushed back. Now, the stages where surgery is typically recommended are hemorrhoids in stages 3 and 4. But sometimes, even in stage 2, if the patient bleeds too much, leading to anemia, then surgery is also the recommended procedure. In order to prevent hemorrhoids, it is important to avoid constipation. So intake lots of foods that produce soft stools, such as foods high in dietary fibers, and avoid foods that are known to cause constipation. Also, it is good to avoid foods that may cause diarrhea, as it can cause inflammation of the rectal area and lead to hemorrhoids. Both can be aided by proper foods and supplements. Also, it is best to avoid alcohol and tobacco, especially alcohol. In summary, avoid spending prolonged periods in the toilet to help prevent this condition. Thank you for joining us in yet another video covering key health-related topics with CloudHospital TV. If you have any questions or comments, please leave it below and we will respond to you as soon as possible.